Greetings and welcome. Thank you once again for spending a few minutes with us to learn what's happening here at FHN. This week, I'm very pleased to be able to have Margie Kochsmier joining us. And Margie is an infection preventionist, and she's been with the organization for 28 years and been doing infection prevention work for 13 years. So we're really privileged to be able to have somebody with her experience and expertise helping us at this critical time.
As the nurse infection preventionist at FHN, I am trained in epidemiology principles. I'm responsible for the surveillance, analysis, interpretation, and reporting of healthcare-associated infections. I do education with staff regarding infection prevention, and the role involves developing policies, procedures, and plans, and I have to ensure that our infection control program meets regulatory standards. The requirement for this role is a Bachelor of Science in Nursing, of 5 years clinical experience, and I hold a master's degree in nursing with a specialization in healthcare education. I have certifications in med-surg and in infection prevention, and have 25 years of nursing experience. I am very honored to work with Dr. Geller, our infectious disease specialist, who has over 40 years of experience and has connections with people all over the country that help give us good care for our patients. These are rare qualities for a hospital our size, and we are fortunate, as is our community. As patients start to return for their appointments or procedures, our priority is safety. We are continuing some of our usual practices, our cleaning and disinfection. We are still taking care of non-COVID patients in a safe manner during this pandemic. We also use our UV light disinfection robot, Trudy, and this helps us clean and disinfect for our next guest. We have a standing committee that reviews cases and allows us to continue our improvement at FHN. We have won awards for safety, and we are very proud of that. We've adjusted some of our usual practices during this pandemic. We've had to limit visitors, and we've asked our visitors sometimes to wear masks when they're here. We've changed the timing of surgical procedures, so we've done some urgent and emergent procedures, and now we're just starting to get back to some of our elective procedures. We've changed locations of some of our inpatients. We have designated units for COVID patients. Non-COVID patients have a different unit, different staff, and then we have a surgical unit for patients coming in to have surgery. Our commitment to healthcare excellence has continued, as well as our commitment to the safety of our staff and our patients. Since the start of the COVID-19 pandemic, we have had daily updates from our CEO, Mark Gridley, so that staff stay up to date on what's happening with COVID-19. We have weekly call-in meetings for our providers and for our staff. This keeps them up to date, and they can ask questions, and they are staying informed. The virus that causes COVID-19 is an enveloped virus. It's wrapped in an outer coating, and it's easily deactivated. The virus that causes COVID-19, while it's easily transmitted, it's very easily deactivated with detergents, with alcohol-based cleaning products, soap and water, or heat. Bleach can be used for COVID-19 cleaning and disinfection, however, it is not necessary. There is challenges, though, with COVID-19, and it's that people can transmit this virus without having symptoms. This is the reasons that we have to follow certain precautions right now. The virus that causes COVID-19 can be spread directly or indirectly. Directly, it is through droplets when someone sneezes, coughs, talks, and that's the reasons why we're wearing cloth masks in public and masks in the hospital. This prevents respiratory secretions from landing on the face of the person that you're talking to. It's the reason for the 6 feet distance between persons. If 2 people are wearing masks, that is good protection, and the chance of transmission of this virus is very rare. Indirectly, it happens when an infected person coughs, sneezes, talks, and their droplets land on a surface. The next person touches that surface and then touches their face. So this is the reason why we need to keep our surfaces wiped down. We use hand sanitizer after we've been out in public, and you're starting to see stores that are disinfecting places in the store that they normally don't, at the cashier, the cart handles. So remember when you're out in public not to touch your eyes, nose, or mouth. If you work in an office where there's shared equipment and you are sharing a phone, a computer, a desk, or a table, make sure that it's being wiped down in between users. This virus that we know of is not being transmitted in blood, so blood transfusions and blood donations are still safe. FHN's prevention efforts is to minimize the transmission of this virus to patients and staff. We've restricted visitors, and the reason for that is to reduce the amount of people that are entering the building that could unknowingly have COVID-19. You'll see social distancing decals on the floors as a reminder to keep that 6-foot distance. You'll see that we've removed our salt and pepper shakers in the cafe on the tables. As restaurants reopen, you can expect that you will see salt and pepper shakers gone from the tables and see single-use packets. We've turned our water fountains off to reduce the risk of contamination. We have spaced our appointments so that you won't see a full waiting room, so that we can keep a distance safely between people. And we have asked our patients that are coming in to wear masks. Things that are happening behind the scenes at FHN, and the things that you're not seeing, is the work that our incident command structure is doing. They're working on plans, policies, procedures. They have to stay updated, sometimes hourly, in the changes that are happening with this pandemic. We have to make sure that we have enough supplies and PPE, or personal protective equipment, for our staff. We have to make sure all of our staff are safe. Our food and nutrition services, as they're doing food preparation and food serving. So gone are the days helping yourself to dishes. You'll see more servers serving you food that's more boxed and ready to go. We have designated units for our COVID-19 patients. These are our isolation units where staff will be seen wearing personal protective equipment that can vary. They'll have face shields, gowns, gloves. Their mask could be either an N95 mask or a surgical mask. In our non-isolation units, this is where our surgical patients are. And the patients are tested before surgery, and so is our staff, so that we know when our patients go to surgery that everyone has a negative result. We have hand sanitizers throughout the building, in the hallways, and as usual, in the patient's room. And our staff do hand sanitizing before and after the care of our patients. Our staff can be seen wearing masks their entire shift, and a lot of people don't know that for a 12-hour shift, the staff is wearing an N95 mask for the entire shift. And this is to protect them and our patients. FHN has to follow the same standards as a large city hospital would. This virus is no different in a small rural hospital than it is in a large city hospital. The only difference is that we aren't seeing the amount of patients that are coming in that are overwhelming us. So when our patients come in, they're getting individualized care. FHN belongs to a regional group that shares information, equipment, plans. We work together so that we have the best outcomes for their patients and ours. We have exceptional providers. Dr. Geller, our infectious disease physician, Dr. Parks, Dr. Kahn, Dr. Kolka, our nursing staff, our respiratory therapists. We have UW-Madison that is cambered into our ICU rooms where they have access to our patients. And recently, UW had made the comment to us that the COVID patients at FHN are receiving exceptional care. Our respiratory therapists are giving individualized care to our patients that are on ventilators that a large city hospital couldn't provide. Our administrators are part of our incident command team. They're working long days, and they are working with our local health departments and other local hospitals to ensure the quality of care we give our patients is superb. I think most important right now is to not let our guard down as the states start to open businesses back up. We've learned lessons during this pandemic. We've learned that germs can be shared very easily. We'll carry the lessons that we've learned during this pandemic with us to keep us healthy in the future. The things that we've learned shopping or dining or going to the doctor or coming to the hospital, we're doing them a little bit differently now. We know that we're not to touch our eyes, nose, or mouth in public, and we've talked about that during flu seasons before. These are entry points for viruses to infect us. Highly touched surfaces in public that we're more aware of than ever. Door handles and gas pump handles and shared pens, packages from FedEx or UPS. There's a lot of people that touch those packages during transit. So when you bring your package into the house, if you're setting it on your table or your counter, really it should be wiped down because that's where you're preparing food and eating. After you open the box, you really should be hand sanitizing or washing your hands. Know that we're still here for you and we want to keep you informed.
So many things are changing at FHN every week. Regardless of the pandemic, we're always trying to look at new ways of doing things and make sure we're keeping up to date and offering the best that we can. However, this week, many things have changed. One of the things that we've learned is that we are getting very good at being able to make sure we can have social distancing, maintain our new COVID-19 precautions and scheduling procedures and having people coming in to visit our offices. And we'll be moving some things around. So we were doing our off-site lab collections at our Burchard Hills locations and Highland View Drive location, and we're going to be relocating those back to the hospital because we feel very comfortable that we're able to do that in a safe, coordinated manner. And so these changes are things that will continue to evolve over time. As we look at the use of our COVID-19 aid tent, we're going to primarily utilize that tent just for testing and allow for treatment to be done in some of our other facilities, including our emergency department as well. So many things are happening and they will continue to do so. When it comes to infection control, I'm very passionate about it. And one of the first things that we do when we welcome new team members to FHN is to talk about the importance of infection control and provide very thorough training. And so we're continually looking at what are leading edge industry practices that have been proven to make sure that we're creating safe environments. And so our infection control policies are updated on a regular basis. And as you've heard from Margie, we really do make a firm commitment to ensuring our staff know exactly what to do. And we start that from almost day one of their orientation with the organization, of making sure that not only they are aware of our infection control policies, but they're very good at being able to practice them. As a healthcare organization, safety is paramount. As we're privileged to care for so many families throughout our community, we want to make sure that we're doing that in the safest manner possible, which means going outside and looking at what are the best institutions doing and how are they doing that. So we connect with places like the Hospital Engagement Network or the Hospital Improvement and Innovation Network, and we are members of the Midwest Alliance for Patient Safety as well, including a commitment to what we call Vizient, which helps us work with other collaboratives, which includes organizations such as Mayo Clinic. And we learn what are the best things for us to be able to do to make sure that safe care is being provided. So we're not trying to figure it out on our own. We really are using those evidence-based approaches, and we are making sure that we're measuring that. So our quality department is constantly looking at data. And that data includes if we've had any type of hospital-acquired infection, which we try and avoid, is we want to see what could we have done better and how can we improve that and make sure it doesn't happen again. So the commitment across the organization is very loud and clear, is that this is a good place to be able to receive care, but not only to receive care, but also to provide care. As we think about our employees or our team members at FHN, one of the things that I like to reflect on is if my wife or my sons were working at this organization, what is it that I would want that employer or that organization to provide them? And every one of the team members that we have here is just as important. So we've maintained a good allotment of personal protective equipment, and we've held that very conservatively to make sure that we have it in use in the most appropriate circumstances, so that the people that are on the front lines that need it most are getting the right equipment that they need to be able to protect themselves, and then also protecting their families and coworkers as well as the patients. And that's been a challenge for us through this entire pandemic, is just making sure we're maintaining enough of that safety equipment to make sure everybody is being protected and well cared for. I can't reinforce how important infection control is. One of the things that not many people know about me, but back in 1990, as a young medic in the Army, I was stationed at Dwight David Eisenhower Army Medical Center, and I was part of the infection control team at that time. That was over 30 years ago. And believe it or not, one of my jobs was to go out and teach staff to wash their hands. So I would do group presentations on teaching nurses and other medical professionals the importance of some of the infection control techniques back then, which are still some of the best methods for prevention today. So I have a very personal commitment for wanting to make sure that our infection control techniques and our policies are being well adhered to, and that they're staying up to date. As a local independent healthcare system, we are very fortunate to be able to have experienced infection preventionists as well as infectious disease physician. My hope is that the families that we serve are able to see the real healthcare heroes in action. And sometimes that's not being seen with flashing lights or somebody who is wearing a white lab coat. Oftentimes those individuals are the ones that are environmental services workers who are highly trained in making sure that they're getting into the cracks and crevices, using the right disinfectants and protocols for cleaning, as well as using cutting-edge technology like our ultraviolet light to be able to do disinfection, such as our TrueD technology. I hope that people are able to see how hard these individuals are working each and every day to make sure that we have a really safe place to receive care, and also for us to be able to provide that care. These individuals are truly our healthcare heroes, as well as our regular team of caregivers who should be demonstrating in front of our patients good hand hygiene, making sure that we're washing hands, making sure that we're using gloves as appropriate, maintaining our mask, wiping down surfaces, changing the setting in between each patient use as far as for equipment and furniture. Again, there's an entire team that's working to ensure that safety, and I hope that that's observable throughout our organization. Ensuring patient safety is a daily conversation. Every morning at 8:30, the organization brings together a team of department directors or leaders throughout the organization, and we conduct what we call our daily safety and quality huddle. From there, we talk about what kind of things are happening throughout our organization, where we need to be able to deploy resources, what type of patient events have been prevented, or what type of patient events are a potential risk, what's going on with our facilities team, and then also making our plan for how do we ensure that safety is on top of everybody's mind each and every day, so that we avoid mishaps and that we try and reduce any possibility that we would have fallouts with safety. And again, that's not something we did during the pandemic. We've been doing that for years to ensure that the families we're taking care of are being well taken care of. Over the next weeks, as the weather improves, it's a great opportunity to get outside and really get moving. One of the areas that FHN has been active is helping to support our local schools, and we've been doing that through a wonderful program called Miles and Minutes. This Miles and Minutes may look a little bit different this year, but it's going out in full effect. I believe it starts on June 1st, so people can get to our website, www.fhn.org, to find out more information and to get enrolled. But logging those activities, those virtual challenges you may have with friends and family, allow people to log miles and minutes, which we select champions at the end of the program and do some scholarship awards back to our local schools so they can reinvest into our greatest resource, which is all of the children throughout Northwest Illinois and the areas that we serve. I would encourage community members to use good social distancing protocols. Make sure you're washing your hands more than ever. As we start to open things up, so does the potential for contact or transmission of COVID-19. So all of those safety practices that we've been talking about the past couple months, we really need to double down on those efforts. Making sure if you're not feeling well that you stay home, that you don't go out and you're not mixing in with crowds. Whenever you cannot properly social distance, make sure you're wearing a mask. And again, being responsible and being able to enjoy our area to the fullest by supporting local businesses, by getting out, by moving, by interacting with others. I know it's something we're all looking forward to, but we want to make sure that we're doing that in the safest way possible, which means not forgetting about adhering to some of those good practices and guidelines.